people take recreational.
That is so key because most of the time when you hear about magic mushrooms, people are talking about microdosing. Essentially, that's taking a small amount every single day, but that's not how this is studied. In these studies, these patients are given large amounts of psilocybin.
Interesting.
Theoretically, it's about 10 to 30 times higher in terms of the dosage of psilocybin than you would find in a magic mushroom microdose. So that's likely what's driving the effect. But it's so important to understand here, these are not FDA regulated or approved yet.
Yeah.
They're really only used for treatment-resistant depression in highly controlled settings with talk therapy. And that's really key here. It's probably a lot of the reason why we're seeing these significant effects.
Well, right away, people are going to be like, there's a drug here. Is there potential for addiction? What side effects are we talking about? Because you're talking about studies with a medical professional involved, right?
Yeah, absolutely. A highly controlled environment. And the side effects are important to be aware of. Psilocybin can exacerbate underlying anxiety and depression. And it's so important to understand because a lot of the times when people are using these things recreationally, they are not using a known amount. There's no standardization.
Right.
And you can also uncover unknown diagnosis like bipolar disorder. So you have to make sure you're talking to a doctor.
Right.
And you're doing this in a controlled environment. And right now, this is only eligible for those who have gone through the other methods to try to treat their depression.
And this